More on this story, we can bring in William Schaffner, Professor of Preventative Medicine in the Department of Health Policy at the Vanderbilt University Medical School of Medicine. Thank you very much for joining us here on France 24. In the past hour, we have 2 cases of the coronavirus confirmed here in France, the first instances of the virus in Europe. How worried should people be?
I don't think they need to be very worried. Yes, this is a transmissible virus from person to person, but it's not going to spread as widely as influenza, for example. So I think public health authorities, certainly in this country, where we also have at the moment 2 confirmed cases, are on top of it. The patients are isolated, their contacts are being followed, and I think the difference between influenza and the coronavirus in Europe and the United States is going to be very, very large. Much disease due to influenza, relatively little disease due to this new coronavirus, fortunately.
Doctor, can you talk us through some of the symptoms of the coronavirus?
Well, the coronavirus, this new coronavirus, produces symptoms that are entirely analogous to those caused by influenza. You're feeling badly, fever, cough, perhaps a sore throat, and then as the disease progresses, shortness of breath, feeling even worse, sometimes associated with intestinal symptoms, diarrhea, or even vomiting.
Now, we have 26 deaths reported in China, 800 infections. Given those statistics, as you were saying, those odds look good?
The odds look good. It's not as serious as SARS or the Middle East Respiratory Syndrome, MERS virus, both of which were coronaviruses that jumped species and came to humans also. So we like that. And we're going to do further investigations, right? We don't know how many patients there are out there with lesser symptoms who never had to be hospitalized. And we don't know how many people were infected and never got sick at all. That all remains to be determined.
Now, the French health minister said that the 2 people who have been infected here in France had recently traveled to China, to the Wuhan province. In fact, what can authorities in France do if there are flights still operating between the 2? Could screenings help?
Screening will help, and as you know, we're doing that in the United States now at 5 major airports. Of course, the flights are now not coming out of Wuhan, so we'll see how long that continues. But the important thing is, for all clinicians, clinics, and hospitals, now when patients come to them with respiratory symptoms and fever, to ask 2 questions. The first question, have you come back from Wuhan or from China recently? And number 2, have you had contact with someone who's been in Wuhan or in China? No cost, low tech, very important, because those 2 questions will identify the people who will be suspect cases.
In your opinion, does the coronavirus affect a certain type of person in terms of their age? Because from what the French health minister has said, the one patient that has been infected with the coronavirus is 48 years old. Are older people susceptible to the coronavirus?
Well, that 48-year-old is a middle-aged person, as is the 36-year-old person who is in the state of Washington. But in China, where they have emphasized the most severe aspects of the infection, the pneumonia, the large majority of patients have indeed been older persons with numerous underlying illnesses. That's always the case. Those are the individuals who are more likely to get severe infections complicating pneumonia with any respiratory infection, including influenza. As we investigate further, we may find that younger people are also infected. And if they're not, we'd like to find out why.
Now, the World Health Organization says the virus is not yet a global emergency. Is that a mistake? Shouldn't they be getting ahead of this?
They are ahead of it. The World Health Organization is considering this very seriously, and they have another meeting scheduled down the road. There are two mitigating factors. The first is that the fatality rate is very low. That's on the good side. And the other thing on the good side is, at the moment, the indication is that it is not readily transmissible from person to person. So it should not spread as widely as influenza. Those two factors really influence the WHO's decision.
Going back to your point about screening passengers who've arrived from China or the Wuhan province who've been in Wuhan recently, because today Gulf carriers have announced that they will be screening passengers. However, some experts say this is a pointless task. Do you agree with that assessment?
It's not pointless, but it's also not perfect. The two patients who arrived in the United States who became sick were still well when they arrived at the airports in the United States. So it's not a perfect system, but it is a system. And what we want to do is several things to identify patients. And we have given an awful lot of information out to our health departments, state and local, as well as to clinicians. And as I said, at my own institution for several days now, every patient who has a respiratory infection is being asked about contact with China or someone coming from China. That's really the important part.
Dr. William Schaffner, thank you very much for joining us on the program today.